Welcome to the lecture, Cardiovascular System, Heart and Major Blood Vessels, delivered by Professor Dr. Nilesh Kumar Mitra. This is a recorded lecture. As you continue to learn by hearing slide after slide, it is recommended that you pause and go through the slides again by going back and forth to fully understand the concepts. Towards the end, you will see some MCQ questions. You should answer the questions to ensure that you have completed the learning outcomes. The learning outcomes of the lecture Cardiovascular System, Heart and Major Blood Vessels. At the end of this topic, you should be able to describe the orientation and location of the heart, describe the layers of pericardium, explain the external features of the heart, list the prominent parts of internal features of the heart, describe the blood supply of the heart and the related clinical applications, identify the great blood vessels of the mediastinum. Heart is a fibromuscular organ located in the middle mediastinum. The mediastinum is the space between the right and left lungs. Dear students, you may think that the heart is beating posterior to anterior. But heart is mainly on the left side of the thoracic cage and beats from right and posterior to left and anterior. Apex, the most anterior part of the heart, is in the left fifth intercostal space, 1 centimeter internal to the midclavicular line. The left ventricle of the heart forms the apex. Base is the most posterior part of the heart, more towards the right in front of the thoracic vertebrae, and formed mostly by the left atrium. The size of the heart depends on sex, age and fitness level of the individual. The pericardium is a membranous sac which encloses the heart. This membrane is formed by 3 layers. Outermost fibrous pericardium, which is closed above by attachments to the great blood vessels. Innermost visceral layer of serous pericardium, which covers the surface of the heart and is called epicardium. In the middle, the parietal layer of serous pericardium, which lines the inner surface of the fibrous pericardium. A small amount of fluid, pericardial fluid, is located between the 2 layers of serous pericardium. Layers of the heart wall. 3 layers. Outer epicardium or visceral layer of pericardium. Middle myocardium formed by multiple bundles of cardiac muscles. Inner endocardium with single layer of squamous epithelium. Four chambers of heart are right atrium, right ventricle, left atrium, left ventricle. Right atrium receives deoxygenated blood via superior vena cava, inferior vena cava. Right ventricle receives blood from right atrium via tricuspid orifice or valve, and sends blood to the lungs via pulmonary trunk, and then via right and left pulmonary arteries. Left atrium receives oxygenated blood from lungs via 4 pulmonary veins. Left ventricle receives blood from left atrium via mitral orifice or valve, and sends blood to the parts of body and organs via aorta. There are 2 circulations. Systemic circulation helps to supply oxygenated blood to organs, limbs and brain. Left ventricle pumps blood to body parts and organs via aorta. Veins carry deoxygenated blood, and via superior vena cava and inferior vena cava, bring back blood to right atrium. Pulmonary circulation helps to supply deoxygenated blood to the lungs and bring back oxygenated blood to the heart. Right ventricle receives deoxygenated blood from right atrium via atrioventricular valve, and sends via pulmonary trunk and 2 pulmonary arteries to right and left lungs. After being oxygenated, this blood comes back to the left atrium of heart via pulmonary veins. The right border of the heart is formed by the right atrium only. The left border of the heart is formed mainly by the left ventricle and also by a small part of the left atrium. The inferior border of the heart is formed mainly by the right ventricle and a small part of the left ventricle. Apex of heart is formed by the left ventricle. Thank you. Please try to answer the quizzes next.